Hi friends, welcome back to my channel Essence of Earth. I am your hostess with the mostest, Miss Nikita. And y'all know over here we're going to focus on everything that's going to help you improve the quality of your life. I'm doing something a little different today. I'm going to give you a book review. I am a lover of books about health and things like that. So I read a lot of books, and I was reading through this book last night because I am in the process of writing my own book, and I was getting some information. I remembered this had some really good information, so I kind of want to come on today. I'll just give you a book review, and the name of wait, I can't believe I always forget this, but before I get into the book review, we got to be friends, right? So y'all know the routine by now. I'm sure you do, but you got to go ahead on and subscribe and click the notification bell so you'll be notified every time I post. And lucky for you, that's like every day, every other day now. So go ahead, moment of silence. Thank you. All right, so let's get into it. And first of all, friend, I love the title of this book, Dead Doctors Don't Lie. I know it kind of got like a sting to it, but y'all know them doctors be lying. Y'all know them doctors be lying. Y'all be like, why my doctor ain't tell me this? Why my doctor ain't tell me? Why my doctor ain't do this? Why my doctor ain't do that? Y'all know doctors be lying, okay? But in this book, okay, let's see. If I had to rate the book, I would probably rate it out of a 7 out of 10. I have ADHD. I have undiagnosed ADHD, and I'm probably going to create an herbal formula or tonic for that. I just haven't gotten around to it yet, but it's in the works, okay? And I will be the first one using it. But I have undiagnosed ADHD, so I really have to read stuff that really keeps me engaged, right? Otherwise I'll be like, why the heck am I reading this? Like, this isn't keeping me engaged. It's kind of boring. I need a twist in the storyline or the information. While I do appreciate him, first of all, Dead Doctors Don't Lie by Dr. Joel D. Wallach and Dr. Malan. Okay, this is what it looks like. And of course, you can support me by subscribing, and then you can get the book from my Amazon store. And I do get paid commissions for that. So thank you if you're interested in getting this book. But yeah, while I do appreciate, learning the backstory behind like the history of how he got to where he was and what he did, while I do appreciate that, just in the book, the book was about that. Now, he did mention some things, like pretty much how a lot of the doctors, like, they die actually before a lot of their patients because of their lifestyle and stuff like that. Not all doctors, but he mentioned that several times, which is how he got the title Dead Doctors Don't Lie. But a lot of the doctors, they end up dying before their patients or dying at an early age. And then he had his backstory, and it was just really long. And that kind of bored me. Like, I wanted it to hurry up. He went through a lot of trials throughout, getting to the point where he has this huge company where he's selling like minerals, real minerals, for health, like 99 essential minerals or something like that. I actually bought it, plant minerals, and I also bought his selenium from his company. But understanding his backstory, he started out like working with animals, and finding out that a lot of the same symptoms that we have as humans, they also show up in animals. So him being able to see that and wanting to become a veterinarian, and all of the trials and obstacles that he went through to get there, and people not really wanting to take him serious. and stuff like that. And then just becoming so good at it and understanding how essential vitamins and minerals are to certain symptoms that you're having, kind of like linking them. He performed like thousands and thousands of autopsies on animals. So he was able to kind of, say, take this vitamin for this, take this mineral for this, you need this for this, and he was able to do that by working with animals pretty much. So much so that he had this company, I can't remember the name of it, but I'm gonna find it out for you, but Dr. Joe Wallach, and then I'll put it up here so you'll see it. I think it's plant-based minerals or something like that, but I tried it. It was good. I drank it, or I just added it to water. Do I feel like I felt a difference from it? I don't. I just felt good knowing that I was getting the minerals. So, so that was good. But I think the best part of this book, which is why it was so hard to go any lower than a 7, is because the end of it, like, at the end was my favorite. Just because it got to what I was interested in, right? And that's the minerals, and that's learning about different ailments, right? Because that's what I'm in the business of, is herbs and minerals, and learning how I could help someone who has an issue, a health issue, and wanting to be able to help them. So oh my God, something in my eye. It's probably my weave. Okay, but anyway, so that was my favorite part. It really was. So I highlighted some sections on here because I wanted to go over some of my favorites, and I guess we'll see. And in the book, listen to this. He says some 79 minerals have been detected in animal and human tissue, blood, liver, muscle, brain. Their presence in the tissues fulfills the first criteria for calling a mineral an essential nutrient. Literally, thousands of studies provide additional support for considering 60 of these 79 nutrients to be essential. These studies were done on animals at every stage of life: pregnant, suckling, weanling, and mature. Furthermore, these studies were carried out on animals in virtually every description: laboratory, mice, rats, rabbits, hamsters, guinea pigs, rabbits, dogs, cats, pigs, sheep, cattle, chickens, turkeys, and ducks. These minerals are considered essential because they are known to act as cofactors for DNA, RNA, enzyme systems, or cofactors for vitamins. So then he lists all of these vitamins. Okay, so let's look at one that I have here. Common calcium deficiencies. Okay, now when he mentions like the element, the calcium, I mean, he goes into like all of the history of that mineral or that mineral element. But listen, so common calcium deficiencies: osteoporosis, Wagner's hump, lordosis, compression fractures, spontaneous fractures, receding gums. Like, who would have known that? Is your dentist going to tell you that? You know what I'm saying? Receding gums, osteoarthritis, degenerative arthritis, hypertension, right? Insomnia, kidney stones, bone spurs, calcium deposits, cramps and twitches, PMS. Did you know that? PMS, sciatica, low back pain, Bell's palsy, tinnitus, spinal stenosis, osteofibrosis, panic attacks, elevated blood calcium, and prolonged clotting time. Who would have known that? Like, that's why I like reading books, because they're like, you're not gonna get this information from your doctor. I'm sorry. Like, your doctor isn't gonna tell you that. You know what I'm saying? And it sucks that it has to be this way, but it's the absolute truth. But what else is in here? I have something else. Like, look, y'all. Like, this was my favorite part. I couldn't rate it any lower than a 7. I could not, because of this stuff right here. This, I love this stuff. So listen to what he has to say about calcium. Is the most abundant mineral in the human body. The average male has 1,200 grams and the average female has 1,000 grams. Calcium makes up 2% of the adult body weight. Water makes up 65 to 75%. Calcium also composes up to 39% of the total mineral reserves of the body ash. 99% of body calcium is found in the bones and teeth. The other 1% is found in the blood, extracellular fluids, and within cells, where it is a cofactor and activator for numerous enzymes. That was it. That wasn't it. Listen, calcium is mainly absorbed in the duodenum, where the environment is still acid. Once the food in the intestine becomes alkaline, absorption drops. Calcium is absorbed from the small intestines by active cellular transport and by simple diffusion. Metallic calcium absorption may be limited to 10% or less and is affected by many substances in the gut. Calcium is highly absorbable, up to 98% in the organically bound plant-derived colloidal mineral and water-soluble chelated form. That is the name of the product that he sells. It's called plant-derived colloidal mineral and water-soluble chelated form. Causes of calcium deficiency, right? Include a lack of vitamin D. So does a deficiency of stomach acid. Like, I was like, wow, how could those two be related, right? Lack of stomach acid. Often the lack of stomach acid, or hydrochlorhydria, results from a restricted salt intake, lactose intolerance, celiac disease, high fat diet, and low protein intake, and high phytate consumption can lead to calcium deficiency. This is so cool. Like, seriously. Phytic acid is a phosphorus-containing acid compound found in the bran of grains and seeds, as well as stems of plants. Oatmeal and whole wheat especially contain phytic acid. Wow. I just love stuff like this. I do. I really do. What else do we have? I have magnesium deficiency diseases, right? Asthma, anorexia. How do you put those two together? Anorexia, menstrual migraines, growth failure, neuromuscular problems, depression, the tremors, vertigo, calcification of arterial media, malignant calcification of soft tissues. Like, wow. What else is in here? And listen, selenium deficiencies. Oh my God, this is what I was looking up the other day for my book. I really want to read the whole thing, but I don't know if this is going to be too much. But this was like great. Where do I want to start? Okay, I want to start here. Selenium deficiency diseases. Okay, listen to this. Again, anemia, right? Age spots and liver spots. He mentioned something specifically about liver spots. I'm going to have to read that. Fatigue, muscular weakness, fibromyalgia, scoliosis, muscular dystrophy, cardiomyopathy, heart palpitations, atrial fibrillation, liver cirrhosis, pancreatitis, pancreatic atrophy, infertility, low birth weight, high infant mortality, SIDS, sudden infant death syndrome, cystic fibrosis, and then he has indirect results here. HIV, and then he has in parentheses, increased rate of conversion to AIDS and transmission to fetus. Lou Gehrig's disease, MS, Alzheimer's, and cancer. Selenium deficiency can result in infertility in both men and women. Congenital selenium deficiency during pregnancy can result in a wide variety of problems ranging from miscarriage, low birth weight, high infant mortality, cystic fibrosis. I just mentioned all of these above. In the young adult, selenium deficiency appears as anemia, chronic fatigue, muscular weakness. Cardiomyopathy is quite common in young athletes, such as basketball and football players. This is good for like people with like athletes, children who are athletes and stuff. Basketball, football players in high school, college, universities, and professional levels because of selenium deficiency, as are multiple sclerosis and liver cirrhosis. So cool. But there was one thing that really stuck out about selenium and HIV. Listen to what he says. The School of Pharmacy from the University of Georgia released a report in August of 1994 that concludes that a human selenium deficiency is related to the clinical onset of full-blown AIDS in chronically infected HIV patients. According to their report, HIV requires large amounts of selenium for replication. In selenium deficient patients, the virus competes with the patient for the limited amounts of available selenium. The HIV patient actually dies from a chronic selenium deficiency, I can't say this word, encephalopathy, liver cirrhosis, or cardiomyopathy. Long-term HIV patients, 20 years or more, that never developed full-blown clinical AIDS had supplemented with large amounts of selenium. Like, wow. Who's going to tell you that? You literally are going to have to read about, you have to read about this stuff in order to learn it. Like, that's why I'm just like an avid reader. I just love it. So then he has a bunch of like issues here, problems or symptoms that one may have, and then he goes into telling you what to do. So let's see if we can find a so let's look at this one. Here he lists asthma. A lot of people suffer from asthma. Let's see what he says. It is a respiratory disease that is characterized by sudden onset of closure of bronchial tubes by spasmodic muscles. This is what he recommends. Treatment should include betaine HCI, which is hydrochloric acid, pancreatic enzymes, and ox bile at 75 to 200 milligrams each, taken before meals. Autoimmune urine therapy, essential fatty acid at 5 grams, plant-derived colloidal mineral suspensions that contain magnesium and manganese should be taken. Herbs are very useful for treating asthma, with some caution when you have allergies to plants. Useful plants include honeysuckle, leeks, garlic, primrose oil, or fluid extract. A variety of standard inhalers are available to cope with sudden attacks. And let's see what else. I'll give us one more. I want something that's like really common. Ooh. Treatment of cancer is a busy procedure at best until you get it under control. It will take your full-time effort, whether you opt to take the cut, burn, and poison route as well, or if you opt totally for alternative therapies. A useful fact to help your thinking process is that the United States government says that the 5-year survival rate of cancer patients has not changed over the last 20 years despite new techniques in surgery, radiation, and chemotherapy. In fact, untreated patients as a group survived longer. What the government doesn't tell you is that the untreated patient group includes those treated with alternative therapies. And we'll end on that. So it is a good book, 7 out of 10. If you enjoy learning about the, like the ups and downs of a person, like their backstory, go ahead. The way my brain works, I need something that's going to keep me interested. I need the meat. I need the steak and potatoes up front. Skip the rolls. Nothing to drink. I need the steak and potatoes immediately. And that's what I need to keep me like interested right from the beginning. I think, his history is amazing. I think he did some great things. And I just love the end of the book because it got me exactly what I wanted. But again, this is a 7 out of 10. It is a good book. It is, as you can see, I still use it. I use it more as a reference book when I'm teaching something or helping someone. It's something that I go back to and look at. So it is a book that I will most definitely keep on my shelf.